Jason, sleep apnea is a term that we hear a lot. What exactly is it?
So what we're talking about is very brief pauses in breathing during the night. And there are two types. A full apnea is where there's a complete cessation in the breathing, so the airway gets completely blocked, or a hypopnea, and that's where there's a partial closing of the airway. And what we do is we determine how many events we get, both hypopneas and apneas, for every hour of sleep.
Right.
That gives us something called an AHI index, which is an apnea-hypopnea index, and that's used generally to define whether somebody has sleep apnea or not.
Right. Is it normal to have some apneas, or is it always abnormal?
So we generally talk about 0 to 5 events being perfectly normal.
Okay.
And, that's going to be affected by factors. If you've had a drink, there is more likelihood that you're going to have more apneic events. Once we go beyond 5, that's when we start to look towards mild, moderate sleep apnea. And then the further up and the more events you're having per hour, the more likely it's going to be a more severe case.
Okay. What symptoms might somebody experience if they have sleep apnea?
People may get headaches in the morning, cottony, dry mouth in the morning. So it's all really around that waking up period. But the biggest significant symptom that we see of sleep apnea is excessive daytime sleepiness. So people may say, I've slept for 8 hours, but I am so tired. I need a nap. Or I'm not efficient enough or alert enough to drive. That is a really good indicator that something's wrong at night, and that's when we need to work out whether it is sleep apnea or not.
And there's a set of questions actually that we use often in general practice where we ask questions relating to that. Can you watch TV without falling asleep? Can you read a newspaper without nodding off to sleep?
Yeah, we're just gauging somebody's levels of daytime sleepiness to see if they're excessive and potentially could become problematic on the road.
Okay. Are there certain people who are more likely to suffer with this than others?
Certainly ageing is an issue for both men and women, especially after menopause for women. There's also the issue, of course, as we get a little older, we get a little bit more weighted.
Yes.
And especially if the weight focuses around the throat or around the belly, then we are more likely to have those apneic events at night. Largely, we do talk about it as a male-related problem.
Yeah.
But again, as I said, once we've gone past menopause, then it actually becomes a problem for both.
And there's something, I remember something about people if they have a chin that isn't very far forwards, if, just naturally their bone structure of their skull means that their chin is sort of quite far back here, they're at higher risk?
Yeah, and if you've got a deviated septum.
Right.
So there's lots of issues. Anything that really comes from the nose right the way down to the throat can impact on our ability to keep that airway open at night.
Okay. Is it dangerous?
The main challenging part about it is you stop breathing at night, and what has to happen is your brain has to send a signal to the heart to pump to get you to breathe. And you'll tend to see it in the sense that somebody will be snoring quite loudly, and then all of a sudden they stop. And then there'll be a very big gasp. And that's them regaining back the air.
Right.
Now, this is all happening, so that's putting a lot of pressure on the heart, for example, at a time when the heart should be resting and relaxing and working to repair itself.
Yeah.
And so therein lies the problem in terms of the physiology. It can relate to problems around cardiovascular health.
Right.
The other, of course, associated issue is that daytime sleepiness.
Yeah.
We are going to become a little bit more accident prone. We may not be as great on the roads. And so there's lots of issues associated with the daytime sleepiness, as well as the issues around the physiology itself.
Okay, so what's the best way to treat it?
First thing to do is not ignore it. And this is really important. About 85% of sleep apnea goes undiagnosed.
Wow.
I
that
know.
much?
Yeah. And so it's not to ignore it, not to trivialize snoring. Go and see a GP if you suspect that there's a problem there. In the majority of cases, it's actually partners who are persuading the other partner who is snoring to go to the GP. So it's mindful to not trivialize it in that way. GPs are really great at pathwaying you to getting the right tests to determine whether you've got sleep apnea or not.
Okay. And I guess for people, if they're sleeping on their own, can they record themselves and listen back to see if they had any pauses in breathing?
It's a beautiful idea. We've got a lot of technology now where we can record these things, determine whether we're snoring or not, and more importantly, whether there's those lapses in breathing.
Okay, really interesting. Thank you.